Thank you.
And one more thing, I will request the participants to be on mute.
To request the participants to please be on mute. There is a lot of disturbance coming in. So the outline of this lecture will include what are solvents, occupational exposure, interactions, then various types of solvents and the toxicity induced by them, solvent abuse, then environmental contamination, and then moving on to the absorption, distribution, metabolism, elimination, and the physiological modeling for these solvents. Then further moving to potentially sensitive subpopulation, which includes young population as well as elderly population. Then moving on to exogenous factors and lifestyle affecting the toxicity of the solvents. Then chlorine, covering various kind of solvents, including chlorinated hydrocarbons, fuels and fuel additives, etc. So first is what is solvents? Solvent refers to a class of organic chemicals of variable lipophilicity and volatility. These properties, coupled with small molecular size and lack of charge, make inhalation the major route of exposure and provide for ready absorption across membranes of the lungs, GI, and the skin. So this lecture is more inclined towards the DABT preparation aspirants. So the notes is from the cassette and all book. Everything is taken from that. So I have tried to go through a 90-page chapter and make a presentation on this, and I will also provide the notes for this chapter, which will be definitely make the job easy for the DABT aspirants to go through that. But I definitely welcome if people can add more to that and make more comprehensive notes. Then moving on to solvents, the class-wise generalizations regarding the toxicity. So first is the more lipophilic a hydrocarbon is, it can be a more potent CNS depressant. Then amides and amines are mostly potent sensitizers. Aldehydes are particularly irritating in nature. Hydrocarbons that are extensively metabolized, they are more cytotoxic or mutagenic. And the unsaturated short chain halocarbons are more of animal carcinogens. Then coming on to the occupational exposures. So although I know that there will be a separate lecture covering the occupational exposures. So I'm not going into the details. I am just covering here whatever is given in this chapter. So the ACGIH, which is the American body, they gave a TLV for an 8-hour workday, 40-hour work week, which is designed to be productive for a working lifetime. This is similar to a PD for a pharmaceutical. The short-term exposure limits or ceiling values, they are designed to protect against the acute effects of high-level or short-term exposure. ACGIH also assigns a skin notation to a solvent, indicating that a significant contribution to overall exposure is possible by the dermal route, either by contact with vapors or direct skin contact with the liquid. I have published 2 papers in the field of risk assessment and one is in the field of occupational exposure limits, particularly related to the pharmaceutical industry. And the another one is the on the permissible daily exposure limits. So if anyone is interested to read on these, then I can also share these papers along with the organizers, so they can share it with you. Then coming on to the interaction of solvents. While the assumption is frequently made that the toxic effects of solvents are additive, the chemicals may also interact synergistically or antagonistically. For example, repetitive alcohol consumption induces certain cytochrome P450s, and they may therefore enhance the metabolic activation of other solvents through cytotoxic metabolites. Another well-characterized example of solvent antagonism is the competitive metabolic interaction between benzene and toluene. Co-exposure to these chemicals results in diminished benzene metabolism, genotoxicity, and erythropoietic toxicity related to that which follows benzene exposure. So this is an example of solvent antagonism, typical example. Then coming on to the toxicities produced by various solvents. So encephalopathy, if the definition is a term that refers to brain disease, damage, or malfunction. Encephalopathy can present a very broad spectrum of symptoms that range from mild, such as some memory loss or subtle personality changes, to severe, such as dementia, seizures, coma, or death. Chronic solvent encephalopathy, which is called CSE in short, is characterized by non-specific symptoms, example headache, fatigue, mood disturbances, and sleep disorders, with or without changes in the neuropsychological function. Chronic low-level exposure to few solvents or solvent mixtures can produce a pattern of neurologic dysfunction referred to as Painter syndrome or chronic solvent encephalopathy. So this is a point to remember that Painter syndrome is actually chronic solvent encephalopathy. And I think this I told in the first chapter also that this is called because this was observed in the workers who are involved with painting or handling paints. Then moving on to the next thing is now anhexane and carbon disulfide can cause specific degenerative changes in the CNS or the peripheral nervous system. Sorry. Then coming on to the solvent abuse, leukoencephalopathy, also known as multifocal demyelinating disease, involves structural alteration of cerebral white matter in which the myelin sheaths that cover nerve fibers are destroyed but axons are largely spared. And toluene is an example of white matter toxicants identified to the date. So toluene produces leukoencephalopathy, and here you can see in this section of the brain that here you can see this white patch. So here you can see that leukoencephalopathy is being produced by a chemical. And dementia in toluene abusers has been referred to as toluene leukoencephalopathy. Dementia is the loss of cognitive function of the person. Then coming on to environmental contamination. So chloroform is the most frequently found volatile organic compound in drinking water supplies in the US. Since the book is from US, so the examples are also from US. It is formed by reaction of the chlorine added as a disinfectant with natural organic compounds present in the water. So you know that chlorine is added as a disinfectant, so it interacts with the organic compounds and forms chloroform. Volatility and lipophilicity are two of the most important properties of solvents that govern their absorption and disposition in the body. Many solvents of particular concern are relatively lipid soluble and volatile, hence their designation as VOCs or volatile organic compounds. These compounds have relatively low molecular weight and are uncharged. Thus, they pass freely through membranes from areas of high to low concentration by passive diffusion. Then moving on to the absorption of VOCs. Majority of systemic absorption of inhaled VOCs occurs in the alveoli. The blood to air partition coefficient of VOCs are important determinants of the extent of their uptake. The partition coefficient is defined as the ratio of concentration of VOC achieved between two different media at equilibrium. As blood is largely aqueous, the more hydrophilic solvents have relatively high blood to air partition coefficient, which favor their extensive uptake. And then the important determinants of the rate of dermal absorption of solvents include the chemical concentration, surface area exposed, exposure duration, integrity, and thickness of the stratum corneum. and lipophilicity and molecular weight of the solvent. Another thing to remember is that the dermal permeability constants are typically 2 to 4 times lower for human than for the rodent skin. So there is difference in the permeability of the human and then as compared to the rodent skin, and that is why you see that in most of the permeability experiments or experiments which are more related to skin. Sorry, the the model that is more used is human skin, which can be a 3D culture model or skin samples taken from the dead humans from the hospitals. So instead of the rodent skin, because the permeability is different. Then moving on to the transport and distribution. So pulmonary first pass elimination is believed to be a zero order process, as a fixed percentage of the chemical is thought to exit the pulmonary blood at each pass through the pulmonary circulation. All of the cardiac output passes through the pulmonary circulation versus about 20% for the GI tract. The alveolar surface for absorption is approximately 20 times that of the entire GI tract in humans. Then moving on to the further transport and distribution, the test chemicals are typically, given daily to animals as a single bolus, which is normally the route of administration in the animals by gavage in short and long-term oral toxicity and CAR-C studies. However, acute human exposure to solvents in drinking water are quite different in that people typically ingest water in divided doses. So the exposures will be small doses over longer period of time over the day, while in case of animal studies, it is given as a single or a BID dose by gavage. So there are some examples like high daily gavage doses of chloroform and other halocarbons have produced hepatocellular carcinoma in B6C3F1 mice. No evidence of hepatic tumorigenesis was seen, however, when these mice were given the same doses of the chemical in the drinking water. So by changing the route, the effects are different. And similarly, female B6C3F1 mice exhibited hepatocellular necrosis and regenerative hyperplasia when gavage with CSCL3. Consumption of the same doses in water were without ill effect. So you see that when the doses were given as a gavage, the effects were seen, while when it is given as a water in water, there were very less or no effects. So the route of administration also matters when you are administering the chemical to animals in the animal studies. Then moving on to the metabolism part. So first is what is metabolic inactivation or detoxification. So conversion of a bioactive parent compound to a less bioactive or inactive metabolite that is are efficiently eliminated is called metabolic inactivation or detoxification. So toluene accumulates in neuronal membranes and inhibits their functions. And toluene is metabolized to hydroxyl and carboxyl metabolites, which are too polar to accumulate or remain in the substantial quantities in neuronal membranes. Thus, metabolism serves to detoxify and accelerate the elimination of toluene. So you see here this toluene is metabolized to hydroxyl and carboxyl metabolites, and which are polar, so they cannot accumulate, and then they are eliminated. So this toxicity is reduced because of the metabolism. While metabolic activation or bioactivation is the term used for metabolism of other solvents can produce reactive metabolites that are cytotoxic or mutagenic. So example is benzene. So benzene is oxidized to a variety of epoxides, quinones, and semiquinones that can produce hematopoietic toxicities and leukemia. Benzene and many other VOCs are converted via multiple metabolic pathways to products of varying toxicities. So benzene, when it is metabolized, the toxicity is amplified. Then, what is the role of CYPs or cytochrome P450s in the metabolism? So, some 40 different human CYP isoforms have been identified to date, but six, which includes CYPs 3A4, 2D6, 2C9, 2C19, 2E1, and 1A2, account for the majority of xenobiotic metabolism. And CYP2E1 is a major catalyst of the oxidation of a variety of low molecular weight xenobiotics, including many solvents. So in this whole chapter, you will see that mainly CYP2E1 is responsible for the metabolism of most of the solvents, and CYP2E1 activity is associated with the pathogenesis of alcoholic cirrhosis through formation of highly reactive oxygen radicals and acetaldehyde from ethanol. Ethanol is an effective CYP2E1 inducer when ingested repeatedly in substantial amounts. The person who drinks in such a manner may be subject to potentiation of solvent toxicity due to increased solvent metabolic activation. So, the people who are consuming alcohol on a regular basis, there the CYP2E1 is induced and which caused potentiation of solvent toxicity. Then moving on to the elimination. Recovery, this is an example of recovery of rats from toluene and acetone anesthesia. So recovery of rats from toluene anesthesia occurs within minutes of exposure sedation. This can be attributed to raised distribution of toluene from the brain to body fat and other tissues, as well as to relatively rapid metabolism and exhalation. So here you can see on this figure that toluene, when given within few minutes, it is eliminated from the body. Um, and another example is acetone. So in contrast, recovery from acetone narcosis does not occur for at least 9 hours post-exposure. As acetone is water soluble, limited amounts are deposited in the brain. It is instead distributed in the considerable volume of the blood and other body water. Clearance of acetone is slow due to its large volume of distribution and its relatively slow metabolism and exhalation. Acetone's water solubility is responsible for its relatively high blood to air partition coefficient and retention in the blood. Thus, acetone is available for diffusion into the brain and induction of a modest degree of CNS depression for a prolonged time. So here you can see this here figure in this that acetone when given into the to the animal, the hours post exposure or the effect period is very long, and this is because the acetone is available into the body for a longer period of time due to its relatively large volume of distribution and slow metabolism and exhalation. So these are the examples which you need to remember for the exam also. Now coming on to the elimination again. So another example is from benzene for benzene. Slower elimination of benzene from female than from male rats and humans because the females have higher body fat and rat and if you have higher body fat then the animals have shown leukopenia during chronic benzene exposure, whereas their thinner counterparts did not. So if there is presence of fat in the body, then benzene is there for a longer duration, and the toxicities are produced as compared to the thinner counterparts or males where the body fat is less. Then coming on to the physiological modeling, which is called as PBTK, physiological based toxicokinetic modeling. These kind of models have been developed to provide predictions of chemical concentrations in blood and tissues as a function of time. So people who worked in the field of PK analysis or TK analysis, they might be using these kind of models. PBTK models are thus used to relate the administered or external dose to the blood and or tissue internal dose of the parent compound or the bioactive moiety or metabolites. If there is sufficient knowledge of the physiology of the test animal or tissue and interactions of the bioactive moiety with cellular components and ensuring responses, PB physiological based toxicodynamic models can be developed. The models are well suited for use with species to species extrapolations because human physiological and metabolic parameter values can be inputted into animal models and simulations of the target tissue dose and effect in human generated. So these are used when in the early phase also of the drug discovery when the PK data is available from animal models like mice, rats, or maybe dogs also. So the PK guys use this data to extrapolate and derive the human doses and their PK parameters also. Then solvent exposures necessary to produce the same target dose as in humans as those found experimentally to cause unacceptable cancer or non-cancer risk in test animals can be determined for some chemicals with reasonable certainty. So what right now I was talking about the pharmaceuticals. So similarly, it can be done for chemicals also to derive the target dose which can cause unacceptable cancer or non-cancer risk in test animals. In cases where there may be species differences in tissue sensitivity, PBTD models must be used to forecast toxicologically affect target organ doses also. So these models are very useful to derive the target doses for humans. Then moving on to the potentially sensitive subpopulation which might be affected due to solvent toxicity. So first going to children. So how children are affected. So for the children, an additional tenfold safety or uncertainty factor has to be used in pesticide risk assessment when pediatric toxicity and TK data are unavailable. So the people who have the experience of working in the field of risk assessment, they know that safety or uncertainty factors are used to determine safe limits using the doses available from the animal testing to extrapolate the safe levels for the human safety. So this is what is mentioned here is for the pesticide risk assessment, an additional 10-fold safety factor has to be used for children. Then there are several well-known examples of compounds like lead, thalidomide, chloromycetin, and diazepam, to which fetuses or neonates are particularly susceptible, and we know all these examples, including thalidomide. The newborn mouse and rat more nearly resemble the human fetus during the third trimester than during the human neonates' initial weeks and months of life. And people who work in the field of reproductive toxicity, they know what are the various life cycles or age groups in the rodents or non-rodents which resemble more closely to the human ontogeny. Then GI absorption of solvents would not be expected to vary with age, as most solvents are absorbed rapidly and completely by passive diffusion from the entire GI tract. So GI absorption of solvents would not vary with the age. Then systemic absorption of inhaled solvents may be greater in infants and children. Their cardiac output and respiratory rates are relatively high, although their alveolar surface area is lower than that of adults. So the cardiac output and respiratory rates, the higher rates in neonates, make systemic absorption of solvents greater as compared to adults. Then further, the reduced plasma protein binding in neonates and infants may be of consequence for certain solvent metabolites. Low binding capacity for TC or trichloroacetic acid, for example, could result in more of the mouse hepatocarcinogen being available for hepatic uptake as well as for renal clearance. So if the plasma protein binding is less, then more of the toxicant will be available for hepatic uptake and for renal clearance. Then extracellular water expressed as percentage of body weight is highest in newborns and diminishes through the childhood. The larger volume of distribution for water-soluble solvents results in their slower clearance and longer duration of action because the extracellular water is more in newborns. So the solvents which are soluble in water, they are for faster absorption. Thus, this enhances the toxicity of the solvent in the newborns. Then body fat is high from about 6 months to 3 years of age, and later on this steadily decreases until adolescence, when it increases again in females. So the lipophilic solvents or the fat soluble solvents accumulate in the adipose tissue, then more body fat would result in higher body burdens, slower clearance, and longer duration of action, thus enhancing the toxicity of the lipophilic solvents. Then poisonings of premature and term human newborns by benzyl alcohol, hexachloroquine, diazepam, chloramphenicol, and certain other compounds are primarily attributable to deficits in hepatic phase 2 metabolic, that is conjugative capacity. Levels of CYP2E1, the primary catalyst of oxidation of a variety of solvents, are very low in fetal liver, increase steadily for the first year, and remain relatively constant through adolescence. More rapid systemic clearance of many compounds by young children than by adults is generally believed to result from the child's liver's larger volume and more rapid perfusion rate. The rapid systemic clearance of many compounds by the young children is due to the child's larger volume and more rapid perfusion rate. Then moving on to the another sensitive subpopulation, which is the elderly population. So older people do appear to be more sensitive to the CNS depressant effects of ethanol, due in part to the lower gastric alcohol dehydrogenase or ADH activity. Uh, then you see that in elderly people, the toxicity of ethanol will be more. With aging, the body fat content usually increases substantially at the expense of the lean mass and body water. The polar solvents tend to reach higher blood levels during exposures. Relatively lipid-soluble solvents accumulate in the adipose tissue and are released slowly to the site of action, metabolism, and elimination. The another thing is the cardiac output. So the cardiac output also diminishes 30 to 40% between the age of 25 and 65 years, as do renal and hepatic blood flow. So these can also further cause enhanced toxicity. Reduced hepatic clearance of the xenobiotics in the elderly is primarily due to reductions in liver blood flow and liver size. So all these factors you see when if you see the label of a drug, so in many of the drugs, for in the label, the doses will be mentioned separately for the elderly and the pediatric population also because of all these differences. Then yeah, then phase 2 conjugation pathways in humans are not altered by aging. Plasma protein binding of drugs generally remains unaltered or diminishes modestly with age. So plasma protein binding is one factor which remains unaltered with age. Then renal clearance diminishes with advancing age due to parallel annual decrease of about 0.65% in glomerular filtration and maximal tubular secretory capacity beyond the age of 30 years. Then moving on to the sex and other differences. As you know that most men have normally more lean body mass and larger body sizes. Women typically have a smaller volume of distribution for polar solvents, but larger volume of distribution for lipophilic solvents because of the higher fat content in the body. Men exhibit somewhat lower blood ethanol levels than women upon ingestion of equal doses, due in part to more extensive ADH catalyzed metabolism of the alcohol by the male gastric mucosa. Women were found to have a higher blood air partition coefficient, a higher percent of the body fat, and higher maximum rate of benzene metabolism than men. Women also exhibit higher blood benzene levels and a 23 to 26% increase in benzene metabolism, potentially placing them at greater risk than men with equivalent exposures. So this is a typical example of sex-related differences in toxicity. The benzene toxicity, which is higher in women because of more of higher body fat content. Then pregnancy results in a 40% increase in tidal volume, which may increase the absorption of inhaled VOCs. Plasma volume also increases about 50% in the pregnant woman, resulting in a decrease in albumin concentration and plasma protein binding of many drugs. Pronounced interethnic differences in rates of ethanol metabolism have been associated with a number of ADH and ALDH polymorphisms. That is why ethanol effects or toxicity are different in between white or Asian population. Then coming on to the exogenous factors which affect the toxicity. First is cytochrome P50. First of all, taking the P450 inducers. So CYP2E1 is a high affinity, low capacity isoform responsible for activation of a wide variety of low molecular weight hydrocarbon and halocarbon solvents to cytotoxins and mutagens. A number of CYP2E1 substrates, example ethanol and other alcohols, acetone and other ketones, pyridine and pyridazine, isoniazid, acetaminophen, chlorozoxazone can act as inducers of the isoform. The minimal hepatotoxicity caused by a low dose of carbon tetrachloride can be contrasted with the centrilobular necrosis in rats pre-treated with butanol before the same carbon tetrachloride dose. If 2-butanol is administered before carbon tetrachloride, then it induces CYP2E1, which reduces the toxicity of carbon tetrachloride. Then coming on to the P450 inhibitors. As I said earlier, I will be providing the notes for this chapter where all these examples will be covered, which will make your job easier to learn all these examples for the exam. Then moving on to P450 inhibitors. So flavonoids in the grapefruit juice were one of the first classes of naturally occurring compounds to be documented to produce clinically significant increases in levels of therapeutic agents metabolized by CYP3A4. And flavonoids in red wine exerted a similar effect on intestinal CYP3A4, but white wine had little influence. So you know next time which wine you had to drink, which is safer. Then coming on to P450 inhibitors further. So bergamottin, furanocoumarin in grapefruit and lime juice was subsequently found to inhibit human CYP3A4 activity as well as intestinal P-glycoprotein efflux transporters. Another example is St. John's wort, which is a top-selling dietary supplement taken for depression. This selectively induced CYP3A4 in the small intestine. Then, okay, it's duplicated. So that is why all these CYP interactions are studied early in the discovery phase in the PK studies. Then moving on to the lifestyle. So fasting for 1 to 3 days can significantly alter the hepatotoxicity of medium to high doses of VOCs that undergo metabolic activation. Fasting results in decreased hepatic concentration of reduced GSH due to the cessation of intake of amino acids required for its synthesis. The hepatotoxicity of carbon tetrachloride, which requires CYP2E1 catalyzed metabolic activation, is more severe in fasted animals. In contrast, long-term food deprivation, that is starvation, results in decreased synthesis and activity of CYPs. So that is why the toxicity of CCl4 can be different in fasted animals or food deprived animals for a longer duration of time. Then pre-treatments of rats with phenobarbital, ethanol, or 3-methylcholine significantly increase TCE oxidation. The same would be expected to occur in humans at high TCE doses. Some drugs such as cycloheximide, disulfiram, and chloramphenicol, and the aforementioned natural constituents of plants inhibits CYP2E1. Then moving on to the some of the examples of solvents which are covered in this chapter, various classes and then representative examples of chemicals from these classes. So the first class is chlorinated hydrocarbons or trichloroethylene. It is well established that TC or trichloroethylene, when given chronically in very high doses by gavage, can produce an increased incidence of hepatocellular carcinoma in B6C3F1 mice, but not in other strains of mice or in rats. This differential susceptibility can be explained in part by the greater capacity of the mouse to bioactivate relatively large quantities of TCE via the oxidative pathway. So this is one example of strain-related differences in toxicity to a particular chemical. The B6C3F1 mouse produces a substantially large amount of TCA after TCE exposures than do unresponsive strains of mice, rats, or humans. This phenomenon may be due to an abnormally high population of spontaneously initiated cells in these animals' liver. Mice express very low levels of epoxide hydrolase, the enzyme that catalyzes the hydrolytic degradation, detoxification of reactive epoxide metabolites of TC and other VOCs. So there is a metabolism difference between the mice, rats, and humans. Coming to this example, which many of the people know or have come across, that is tetrachloroethylene or perchloroethylene or called PERC also. So researchers found increase in protein droplets in cell proliferation in the proximal tubular epithelium of male F344 rats gavaged with PERC. These alterations were accompanied by an increase in alpha-2 mu globulin, a male rat-specific protein. So we know that this alpha-2 mu globulin is present in male rats only, and this is not present in humans also. So any toxicity which is related to this protein has no translation value in humans. The accumulation of alpha-2 mu globulin is cytotoxic, causing cellular necrosis and compensatory cellular proliferation in the P2 segment of the renal proximal tubule. And humans should be less susceptible to hepatorenal injury by PERC than rodents due to the lower target organ doses of the parent compound and its bioactive metabolites. So on the right side, you can see in this figure that the chemical exposure causes binding to the alpha-2 mu globulin, and this causes accumulation in the kidney target cells, and this leads to cytotoxicity and cytolethality, and ultimately it causes kidney tumors. So male and female B6C3F1 mice gavaged with PERC for up to 78 weeks exhibited an increase in hepatocellular carcinoma. No increase in tumor incidence was seen in Osborne Mendel rats. So this is a typical example of toxicity which is related to a particular sex uh, and strain also and species also because it was not seen in rats. Mm. Then moving on to the next chemical in the chlorinated hydrocarbon class, which is 111 trichloroethane, also called as methyl chloroform, which is a widely used organic solvent. It is also used as a metal degreaser, a general purpose solvent, spot cleaner, and component of aerosols and a variety of household products. I don't think that you need to remember all those things, but you should have some basic idea that how the people will be exposed to all these solvents. Acute or chronic inhalation of TRI results in CNS depression, ranging in severity from slight headache or dizziness to anesthesia and death. Then moving on to the next chemical, methylene chloride. So this is used as a solvent in industrial process, manufacture of drug, degreasing agents, aerosol propellants, agriculture and food preparation. Methylene chloride was commonly used also to decaffeinate coffee and tea. So decaffeinated coffee and tea is very popular in US, so that you can enjoy your cup of coffee and tea also and without getting any exposure to caffeine. The primary route of exposure to this very volatile solvent is inhalation. This VOC is also frequently found in wastewater discharges and in air and water at hazardous waste sites. Then moving on to the next chemical, sorry, this is still methylene chloride, and this is the pathway for the metabolism. So there are three pathways actually involved in the metabolism. First is the mixed function oxidase pathway, second is the glutathione transferase pathway, and third is the nucleotide pathway. Then coming on to the next chemical, carbon tetrachloride. So carbon tetrachloride is bioactivated by cytochrome P450 via reductive dehalogenation to trichloromethyl radicals and trichloromethyl peroxy free radicals, which are unstable and bind covalently to a variety of cellular components, including enzymatic and structural proteins and polyunsaturated fatty acids in membranes. This causes lipid lipoperoxidation, loss of intracellular and cellular membrane integrity, and leakage of enzymes. Byproducts of lipid peroxidation include reactive aldehydes, which can form adducts with proteins and DNA, contributing to cytotoxicity and carcinogenicity of carbon tetrachloride. And then moving on to chloroform, it is used in the production of just a minute. Refrigerant, which is chlorodiphoromethane, also called Freon 22. But this use is diminishing, as you all know that fluorocarbons are being phased out because of their diminished effect on ozone layer. Then chloroform was also among the first inhalation anesthetics, but it was replaced by safer compounds after about 1940. Chloroform is also a byproduct of drinking water chlorination and has been quantified in municipal drinking water supplies in concentration as high as several 100 ppbs. Chloroform can invoke CNS symptoms at subanesthetic concentration, similar to those of alcohol intoxication, and can sensitize the myocardium to catecholamines, possibly resulting in cardiac arrhythmias. Then coming to aromatic hydrocarbon and taking benzene as the first example. It is a predominant air pollutant and an important industrial chemical. In gasoline also it is present in the range of 1 to 2%. Cigarette smoke is another major source of benzene. High level benzene exposure results in an increased risk of acute myelogenous leukemia in humans. For benzene, liver is the primary metabolic organ, while bone marrow is the target organ for benzene. Pre-treatment of rats with ethanol CYP2E1 inducer, enhance the metabolism of benzene and potentiates its acute and subacute myelotoxicity in rats and mice. So this shows that if a person is smoking and along with alcohol intake, then the toxicity can be increased because benzene is present in the cigarette smoke. And benzene was retained longer in the females due to their higher body fat content. Then taking toluene as the next example of aromatic hydrocarbons. So toluene is present in paints, lacquers. So lacquers are generally used over the furniture to give them a shining. Thinners, cleaning agents, glues, and many other products. In gasoline also it is present at 5 to 7% level. Toluene is the most commonly misused solvent due to its alcohol-like effects of euphoria and excitation. Solvent abusers intentionally inhale high concentrations to achieve a euphoric effect. Even acute inhalation can lead to life-threatening conditions when poor oxygenation leads to cardiac arrhythmia and other complications associated with hypokalemia. Sudden ischemic death has been documented since the 1970s. This is eliminated in urine as hippuric acid, and CNS is the primary target organ of toluene and other alkyl benzene. Moving on to xylene and ethyl benzenes. So these are the major components of gasoline and fuel oil. The hepatic macrosomal CYP2E1 is the primary enzyme involved in the metabolism of xylene to methyl benzyl alcohols, leading to the formation of methyl hippuric acid isomers. Xylene levels in the blood and its metabolite methyl hippuric acid in urine are the primary biomarkers used to detect exposure to xylene. So these are the biomarkers: methyl hippuric acid and xylene. And then ethylbenzene levels in blood and mandelic acid and phenyl glycoxylic acid in urine are used as the biomarkers of the ethylbenzene exposure. Then coming on to the styrene. This is used in production of polystyrene, rubber, latex, reinforced plastics. It is also there in tobacco smoke, auto exhaust, and emissions from building materials, mainly metabolized by CYP2E1. Then moving on to the next class of chemical solvents. This is alcohols, and the first example is ethanol. So this is used as an additive in gasoline, as a solvent in industry, in many household products, and in pharmaceuticals. Besides, also heavily consumed in intoxicating beverages. The frank toxic effects are less important occupationally than injuries resulting from the psychomotor impairment. Ethanol is metabolized to acetaldehyde. Acetaldehyde is rapidly oxidized by ALDH to acetate, and liver mitochondrial ALDH is a major enzyme responsible for acetaldehyde clearance. CYP2E1 is the principal isoform of the hepatic macrosomal ethanol oxidizing system, and ethanol can be an effective antidote for poisoning by methanol, ethylene glycol, and diethylene glycol. Pre-exposure to a single high dose or multiple doses of ethanol can induce CYP2E1, thereby enhancing the metabolic activation and potentiating the toxicity of a considerable number of other solvents and drugs such as acetaminophen. So, ethanol consumption along with a patient who is taking acetaminophen can increase the toxicity of the drug. Then coming on to the next alcohol, that is methanol. So this is used as a starting material for the synthesis of chemicals such as formaldehyde, acetic acid, etc. It is also found in windshield washer fluid, carburetor cleaners, antifreezers, and copy machine toners, etc. The consumption of adulterated bootleg whiskey is a major source of methanol poisoning. Then significant species differences exist in the susceptibility of methanol toxicity. Acute ocular toxicity, metabolic acidosis, CNS depression, and death in humans are not seen with rodents. So here on this side, you can see the differences in how rodents are metabolizing methanol and how primates are metabolizing, starting from methanol, the conversion to formaldehyde. The enzymes are involved are different in both rodents and primates, and the same enzymes as in primates are present in humans also. Similarly, for the next step, also here the enzyme is similar, but then moving on from formate to carbon dioxide, then the amount of enzyme present are also different. So this is a typical example for the species differences in the metabolism of a particular chemical. So NHPs respond to methanol similarly to humans, as I already said. Humans and non-human primates are metabolized where rodent use catalase as seen here. Rabbit also show similar metabolism as NHPs or humans. And ocular toxicity of methanol is due to formate accumulation, and fomepizole is the primary antidote for methanol poisoning. So this is a good example to learn for the species difference in solvent toxicity, especially because of metabolism enzymes involved. Then moving on to glycose and taking ethylene glycol as the first example. This is a constituent of antifreeze, dicers, hydraulic fluids, drying agents, and ink, and is used to make plastics and polyester fibers. And the production of calcium oxalate crystals in the kidney causes the toxicity. Then coming to diethylene glycol, this is used in brake fluids and lubricants. It is also used as an it was used as an excipient in liquid sulfanilamide preparation, which resulted in 105 deaths in the United States in 1937. And I think this was the first reported case of a mice mass poisoning. And because of this incident, it led to the passage of Food, Drug, and Cosmetic Act in US in 1938. And then use of diethylene glycol, contaminated propylene glycol, or glycerine in various pharmaceutical has also caused multiple fatalities from renal failure in Nigeria, Bangladesh, India, and Haiti. This is a reported example from Cacetanol case. Then moving on to glycol ethers, this is used in gas additives, brake fluids, paints. It is a reproductive toxicant, immunotoxicity also. Then moving on to fuels and fuel additives. So I have only few slides left now. Automotive gasoline is a complex mixture of hundreds of hydrocarbons, predominantly in the C4 to C12 range. I think you all know this. Gasoline is one of the most popular and lethal inhalants, and it is classified as Group 2B, possible carcinogenic to humans. And in the male rats, it causes the renal tumors are caused because of globulin accumulation. The male rat kidney and alpha-2 mu globulin toxicity is also caused by other chemicals like D-limonene, P-dichlorobenzene, and decalin. Then moving on to the next fuel additives, methyl tertiary butyl ether, also called MTBE. This is a replacement for tetraethyl lead as an octane booster for gasoline. So MTBE makes fuel combustion more complete, thereby reducing the pollutant emission from the automobile exhaust. And this is a weak carcinogen as per the EPA classification. Then moving on to the next jet fuel and carbon dioxide. So little about jet fuels because we don't read about these jet fuels in our daily life. So Jet A, Jet Propellant 5, and JP8. These are the predominant jet fuels in use today. All are kerosene-like mixtures of hundreds of aliphatic and aromatic hydrocarbons. Jet A is a commercial aviation fuel. JP5 is used primarily for Navy shipboard aircraft, and JP8 is the battlefield fuel for all NATO forces and is used not only for aircraft but also for ground vehicles and other equipment such as generators. JP8 is thought to be the largest toxicant exposure for the US Armed Forces. It causes pulmonary, immune, and dermal toxicity. Then carbon disulfide, it produces neurotoxic effects, include peripheral neuropathy, encephalopathy, and Parkinsonism. I think that's all from my side for today.